Hello nurses, how are you all, and welcome back to my channel Nurse Navigator Swati. I am back with the first part of Fundamentals of Nursing MCQ question and answers. Review your knowledge and do subscribe for more such MCQs. Let's get started. Question number 1. What is the recommended flow rate of oxygen via nasal cannula? Options are 1 to 4 liter per minute, option 2 1 to 8 liter per minute, option 3 4 to 6 liter per minute, or option 4 6 to 8 liter per minute. A standard nasal cannula is considered as low flow device, so it typically delivers oxygen at 1 to 6 liter per minute. So here option 1 is the correct answer. Question number 2. Which of the following item is not sterilized by antiseptic solutions? Option are suction catheter, enema tube, surgical scissor, or option 4 nasogastric tube. Here surgical scissors are not typically sterilized using only antiseptic solution. They require high level sterilization. So for this question option 3 surgical scissor is the correct answer. Next question. Which ethical principle promotes self-determination by the client? Options are justice, autonomy, option 3 non-maleficence, or option 4 fidelity. Yes, that term autonomy is the capacity for self-governance or independence and the freedom to make informed. Here option 2 autonomy is that ethical principle promotes self-determination by the client. Question number 4. Which among the following technique is used in physical examination? Options are inspection, palpation, percussion, or option 4 all of the above. Yes, you are absolutely right. In physical examination, inspection, palpation, percussion, all the techniques are used. Here option 4 is the correct answer. Question number 5. Which comfort device is used to prevent food drop? Options are bed cradle, sandbag, footboard, or option 4 pillow. Option 3 footboard is a supportive device placed at the end of a bed for patient with food drop to keep the feet in a neutral position at 90 degree. So here option 3 is the correct answer. Question number 6. When taking apical pulse, where should the nurse place the stethoscope? Options are just to the left of the median point of the sternum. Option 2 in the 5th intercostal space at the left mid-clavicular line. Option 3 between 6th and 7th rib at the left mid-axillary line. Or option 4 between 3rd and 4th ribs and to the left of the sternum. While taking apical pulse, a nurse should place the stethoscope in the 5th intercostal space at the left mid-clavicular line. So here option 2 is the correct answer. Next question. A nurse is monitoring manometer for CVP value from a central line inserted via the brachial vein. CVP line inserted in a patient in ICU on face mask with oxygen. For correct reading, she should record the value at option 1. She should disconnect the manometer just before the reading. Option 2 at the end of inspiration. Option 3 at the end of expiration, or option 4 all of the above. CVP normally measures the pressure in the right atrium, so the correct time to monitor central venous pressure in a patient on face masks on oxygen is at the end of expiration, just to minimize intrathoracic pressure impact. So here option 3 is the correct answer. Question number 8. The ability to enter into the life of another person to accurately perceive his current feelings and to communicate these feelings to the patient is? Options are empathy, sympathy, self-disclosure, or option 4 role-playing. Yes, you are absolutely right. This term is called empathy. So here option 1 is the correct answer. Question number 9. A patient receiving parenteral nutrition is administered via the following routes except? Options are subclavian line, central venous catheter, peripherally inserted central catheter, that is PICC, or option 4 PEG tube. Parenteral nutrition can be administered via subclavian line, central venous catheter, or PIC line, but not via PEG tube, that is percutaneous endoscopic gastrostomy. It is a flexible feeding tube inserted through the abdominal wall directly into the stomach to provide long-term nutritional support. So here option 4 is the correct answer. Next question. Kushmal breathing is option 1 prolonged gasping inspiration followed by a very short, usually inefficient aspiration. Option 2 marked rhythming, waxing and waning of respiration from very deep to very shallow breathing and temporary apnea. Option 3 increased rate and depth of respiration, or option 4 shallow breaths interrupted by apnea. Yes, Kushmal breathing is a deep, rapid and labored breathing pattern often described as a air hunger that serves as a compensatory mechanism for severe metabolic acidosis. So here option 3 increased rate and depth of respiration is the correct answer. Question number 11. Nursing responsibility during blood transfusion is option 1. Draw a sample from the patient before each unit is transfused. Option 2. Run the blood at a slower rate during the first few minutes of the transfusion. Option 3. Warm the blood product to body temperature to prevent chilling. Or option 4. Maintain patency of the IV catheter with dextrose solution. Within these options, the nursing responsibility during blood transfusion is to run the blood at a slower rate during the first few minutes of the transfusion. Option 2 is the correct answer. Question number 12. While assessing a patient's cranial nerves, the nurse asks the patient to raise the eyebrows, smile, and to show the teeth to assess which cranial nerve. Options are facial, vagus, olfactory, or option 4 optic. Cranial nerve 7, that is facial nerve, it is a paired complex mixed nerve responsible for the motor control of facial expression as well as taste sensation for anterior 2/3 of the tongue. So here option 1 is the correct answer. Next question. A patient have difficulty in smelling. Nurse assess for which cranial nerve? Options are cranial nerve 4, cranial nerve 3, cranial nerve 2, or option 4 cranial nerve 1. Yes, you are absolutely right. Cranial nerve 1 is the first cranial nerve which is responsible for the special sensory function of smell. So option 4 is the correct answer. Question number 14. In which stage there are formation of blisters? Options are stage 1, stage 2, stage 3, or option 4 stage 4. If there is a formation of blister, that means it is stage 2. Here option 2 is the correct answer. Question number 15. Normal pH range of blood is, options are 7.5 to 7.25, option 2 7.45 to 7.55, option 3 7.25 to 7.35, or option 4 7.35 to 7.45. The normal pH range for human arterial blood is tightly regulated between 7.35 to 7.45 with a mean value of 7.4. So here option 4 is the correct answer. Next question. 0.45% normal saline is the hypotonic solution, isotonic, hypertonic, or colloid. 0.45% sodium chloride solution, it is a hypotonic intravenous crystalloid solution that contains 4.5 gram of NaCl per liter. So here option 1 hypotonic is the correct answer. Question number 17. A patient complaining nausea after having food. It is which type of data? Options are objective, subjective, personal, or option 4 none of the above. Yes, you are absolutely right. Nausea is classified as subjective data because it is an internal self-reported sensation that cannot be directly observed, measured, or proven by a healthcare professional. So option 2 is the correct answer. Next question. We will assess which lab value in renal failure patient. Options are serum calcium, serum magnesium, serum chlorine, or option 4 serum creatinine. The lab value of serum creatinine is to be checked to assess the kidney function because it is the waste product from muscle metabolism that normally a healthy kidney filters from the blood at a relatively constant rate. So for a renal failure patient, definitely we will check the lab value of serum creatinine. Option 4 is the correct answer. Question number 19. You will use which solution for spillage of blood on the floor? Options are phenol mixed solution, Sidex solution, chloride mixed solution, or option 4 formalin. Blood spillage is cleaned with definitely a chloride mixed solution, especially sodium hypochlorite, because they are highly effective broad spectrum disinfectant to inactivate bloodborne pathogens such as HIV or hepatitis B. So option 3 is the correct answer. And the last question of this quiz session is, a patient receive high oxygen concentration by, options are Venturi mask, mask with reservoir bag, option 3 nasal cannula, or option 4 by simple face mask. Yes, a patient receive highest oxygen concentration by mask with reservoir bag at a level of 10 to 15 liter per minute. Here option 2 is the correct answer. So let me know how much you have scored from this video and also mention me in the comment the topic on which you want more MCQs and explanations. See you soon in my next nursing quiz session.